Hope your work week is off to a good start. I'm Min Sun-hee. The world noted yet another record rise in the number of COVID-19 cases over a 24-hour period at more than 230,000 cases. The US led the surge with some 70,000 cases. Korea, for its part, is seeking to better tackle imported infections. And for more on those efforts, I have our Kim Mo-kyun here in the studio. But first, let's turn to our Kwon So-ah for the latest figures on the pandemic. So, how is Korea starting the week?
Well, we have quite a surge in imported cases today. In fact, more than double the amount of local infections, as local infections were reported at 19 cases this Monday. And that figure actually dropped to the teens for the first time in almost 3 weeks, while we have cases from abroad of more than for 43 cases from abroad this Monday. So that number combined brings the total today to 62, and the accumulation is at 13,479. 289 people have lost their lives so far, but no additional death in the span of a day, and 986 people remain in quarantine, while 12,204 people have made a full recovery from COVID-19 here in the country. Now, due to the hike in imported infections, we have quite a surge compared to last Monday. More than a dozen more cases than last Monday. We did have a drop here last week, and the weekend looked actually better than this Monday. So that is a slight concern here. Now, by region, we have most cases here in the metropolitan region, with 11 in Gyeonggi-do province and 13 in Seoul, and 10 of those in Seoul were local infections, whereas only 3 here in Gyeonggi-do province were local infections. And in Gwangju, there were 7 new cases, out of which 6 were local transmissions. And 18 cases were detected at the airport or seaport, and the other imported cases were detected during the self-isolation periods. Now, the increase in imported cases has also got to do with the continuous rise in global cases. Let's take a look at those figures. We have more than 13 million total cases, 471,574 deaths as of 12 p.m. Korea time, and almost 7.6 million people have made a full recovery. And moving on to the most affected countries in the world, the U.S. has been reporting some 60,000 to 70,000 cases on a daily basis, and Florida alone had some 15,000 cases reported on Sunday. That was the highest figure for any state before. So now that brings the U.S. to 3.4 million cases, followed by Brazil at almost 1.87 million cases, that is. And India's cases are surging as well, almost at 880,000. Now let's move over to other places. Mexico has surpassed the total accumulation cases of the UK, soon to hit the 300,000 mark, and soon expected to surpass Spain as well. And here, South Africa at 276,000 cases and around 4,000 fatalities has become the country with the 10th highest figure of COVID-19 cases in the world. And those are the updates I have for now, but I'll be back after the government briefing. Back to you, Sunny.
All right, so thank you for that. I'll see you back at the desk. Up next, a growing number of imported cases here has led to a fresh set of efforts to better contain the outbreak. For more on this, I have our Kim Mo-kyun here in the studio. Welcome, Mo-kyun.
Good afternoon, Sunny.
Right, Mo-kyun, let's begin with today's figures on imported cases. As Kwon So-ah mentioned, we have 43 cases on this Monday, and that's the highest figure in the past 3 months for imported cases.
Yes, as you've mentioned, imported cases of COVID-19 here today was peaked at a high of 43, which is up 20 from the previous day. And this is the second highest since March 25th, where the figure peaked at 51. Now, imported cases as a percentage of all confirmed cases have been rising steadily over the past month, causing concerns of a wider community outbreak. If you take a look at this graph for the past week, the number of imported cases being reported daily is nearly the same or even more than the number of local infections. The good news is that until now, imported cases have not triggered a wider outbreak, as all passengers are required to be in self-quarantine for 2 weeks upon arrival. The health ministry says inbound travelers are not likely to transmit the virus to local residents, but an industry expert says there still remain concerns moving forward.
When they are inside the airplane, they share the same restrooms and have to remove their masks while eating. So there's still a possibility the virus can spread through droplets. But when it comes to aerosol infection, the chances of that are low since the plane uses filtered air.
Filtered air, well, that is good to know. Now, Morgan, the government announced plans to require passengers from high-risk countries to submit test results showing that they've tested negative for COVID-19. Tell us more.
Yes, the Central Disease Control's headquarters announced last week that beginning Monday, people arriving from countries deemed to be at high risk should submit the results of their PCR tests that shows that they're negative. That should be taken before 48 hours from departure. And as of today, those countries are Pakistan, Bangladesh, Kazakhstan, and Kyrgyzstan. But authorities say the list could change as they are monitoring dozens more countries. Also, beginning last week, only 60% of seats on regular flights will be available for passengers arriving in Korea to strengthen social distancing among passengers. The government is also looking to reduce the number of irregular inbound flights from high-risk countries and limit the re-entry of passengers who departed for those countries.
Right. Morgan, can you walk us through the entry protocols for those who are coming into Korea from abroad?
Sure. When a passenger arrives at the airport, he or she should download the mobile self-quarantine application to help authorities take track of their health conditions. Those with symptoms will be sent to designated medical facilities, and those with no signs of illness will be subject to self-quarantine for at least 2 weeks. They are still required to undergo testing at a local clinic before heading home to their accommodations, where they will stay for 2 weeks and are banned from going outdoors for the duration. For those living with their families, they're advised to eat alone, use separate rooms, bathrooms, and sinks, and use a separate trash bin, which will be collected by authorities later. They must check their temperatures and report their health conditions twice a day at assigned time periods through the application. The mobile application could also act as a tracking software that alerts those quarantined if they are out of their boundaries, which will automatically alert their respective handlers who will give them a call.
Right. Morgan, how is the government supporting visitors who do not live in Korea? Where do they stay?
Well, the government is running a special facility for those who don't live at South Korea and for those who want to be isolated in a different place. The facility will provide them with food every day for 2 weeks, but they will be required to pay around $1,160 for their stay, and the facility is strictly off limits to outsiders.
Right. Tell us more about the government's efforts to help those in self-quarantine, Morgan.
Sure. For people who've been put in self-quarantine upon arrival, local governments have been supplying them with a relief package worth $80, which includes packed meals, canned goods, snacks, and sanitizers. And they're given a choice of either receiving the package or hard cash instead. And in addition, various ministries are holding joint meetings on a weekly basis to gauge and analyze the potential dangers that could arise from overseas visitors, as well as come up with new measures to prevent the spread of imported cases to the local community.
All right, Morgan, thank you for that coverage. There was talk about the government's efforts to deal with imported cases.
Thank you.
Right. On a slightly bright note, there are a number of Korean products that are enjoying a surge in sales amid the pandemic. We have details of that in this next report.
K-pop has captivated the global audience, while Korean film has entered a new renaissance period. Korea is also leading the global fight against COVID-19 with its disease control measures. Korea's agriculture and food product exports in the first half of 2020 have swelled compared to the same period last year. The export of Korean instant noodles, or ramyeon for example, has been rising steadily from January, and it jumped 52% year-on-year in April. Aside from Korean food products, eco-friendly appliances are also growing in popularity. In particular, the export of Korean-made bidet toilets to the US has skyrocketed compared to the same period last year. With the explosive growth in global demand, bidet toilet manufacturers in Korea are working around the clock to ramp up production.
비데 수출 물량은 전년 동기간 대비해서 170%가 증가되었습니다. 그중 수출 물량의 90%는 미국으로 수출하고 있습니다. 저희는 수출 물량을 대응하기 위해서 포장 라인을 2개로 증설하여 대응을 하고 있습니다.
But out of the many different appliances, why have we seen such an explosive growth in demand for bidet toilets in particular? Industry experts point to the panic buying of toilet paper, which gripped the US in the early days of the pandemic. As people struggled with a toilet paper shortage, many turned to bidet toilets as an alternative. So then, why are Korean bidet toilets especially popular?
저희가 미국뿐만 아니고 전 세계에 그 지역의 환경을 분석을 하고 있습니다. 그래서 그 데이터를 가지고 그곳의 그런 수압이나 수질, 그 다음에 그 사람들의 사용 습관이나 이런 것들을 가지고 처음에 설계할 때부터 그런 부분들이 반영이 되고 검사도 마찬가지로 그런 부분들의 데이터를 가지고 검사를 해서 출하를 하고 있습니다.
Korean bidet toilets have been recognized for their excellence in the US market. Even still, bidet toilets are not commonly seen in US households and used by only 5% of all Americans. But that could all change in the aftermath of the COVID-19 pandemic. Many Korean products have scored big in the export market, despite the global economic downturn amid the COVID-19 pandemic, offering hope that these sectors and others could springboard a wider recovery in Korea's economy.
Right, the government briefing for this Monday has been delayed by about 10 minutes, which is why we brought you that report fast. And while we wait for that to start, we turn now to Brazil, where more than 1.8 million people have tested positive for COVID-19 and over 72,000 have lost their lives. In fact, Brazil is the second worst hit country in the world after the US. For more on the grim reality there, I have Luana Ferreira, a journalist in Brazil. Hello, Luana.
Hello, Sunny. Good afternoon.
Right, Luana, according to Brazil's health department, 96% of the countries in Brazil have confirmed, cities that is in Brazil, have confirmed COVID-19 cases. How severe is the situation in Brazil right now?
Well, the number shows that we are far away to have the situation under control. As you said, we have over 72,000 deaths at the moment. And this week, we're going to reach the mark of 2 million people infected by COVID.
Luana, Brazilian President Jair Bolsonaro had tested positive for COVID-19 last week, and he held a press conference to address his condition. What was the gist of that press conference?
Yes, during the press conference, he took down a few steps. He confirmed that he has COVID, and he took off his mask. And because he wanted people to see his face, so he received a lot of criticism for that. And he also used his social media to make a live streaming. That's something that he does every week since he became the president. And during the live streaming, he said that since day one, he's taking chloroquine to treat COVID. And he said that it's doing wonders to his health. However, there is no scientific evidence that it really works.
Luana, you mentioned the president taking off his mask during that press briefing, which is why a group representing journalists have vowed to file a lawsuit against him for endangering their health, they say. Please tell us more about that.
Yes, actually it's not a lawsuit, at least not yet. But the Brazilian Press Association, they sent a notification for the Supreme Court in Brazil, saying that Bolsonaro put in risk the life of the Brazilian journalists that were there at the moment. And in case that one of them, they get COVID thanks to Bolsonaro, then they can sue the president.
Luana, given the latest development there with the president testing positive for COVID-19, has there been a tangible shift in the country's strategy against COVID-19?
No, there are no signs of that. As we know, Bolsonaro is well known for downplaying the situation, the pandemic. He said that's just a little flu. a while ago, and something that we cannot say that he's not consistent, because he's very consistent in downplaying the pandemic. And we could see that last week when he was talking about chloroquine and how it's working. So, and he gives no sign that he's going to change this position, this opinion about COVID.
All right, Luana, thank you for making the time to share your thoughts with us live at this hour.
You're welcome. Thank you very much.
Right, we are still waiting for that briefing to commence, and perhaps while we wait for that to begin, we can give you a few reminders for those in the country about the latest guidelines with regard to the pandemic. Now, as of last Friday, all church-related activities outside of the regular service have been banned. Now, these activities include choir practice, Bible study, and meal sharing. The QR code registration requirement has also been made mandatory at places of worship and other high-risk venues such as nightclub and cram schools, as well as fitness centres. Also, the government has ended its rationing of face masks as there appears to be sufficient market supply. People who are now able to buy as many masks as they would like at market prices. The cap on exports of face masks, however, remains, with producers currently allowed to export only 30% of their total output. That figure, however, is looking to rise to 50% in the near future. Meanwhile, with health authorities, with the WHO, that is, the World Health Organization's recent cautious acknowledgement of possible air transmission of COVID-19 within confined and crowded facilities, including restaurants and gyms, the emphasis on the wearing of face masks has been strengthened. Health authorities here in Korea have treated the outbreak as an airborne infection from the start, and thus they claim that there are no changes to current safety guidelines here in the country, and that members of the public must abide by all precautionary measures to ensure their health and that of those around them. Right, there was a short video here from us to you about the importance of wearing face masks in the country as we seek to battle COVID-19 here in Korea and elsewhere around the world. We are still waiting for the briefing to begin. It was supposed to begin at 2:10 but has been postponed by about 10 minutes. While we wait for that to commence, perhaps we can take a look at the figures for this Monday here in Korea. We have 62 new cases in the country, raising our total to 13,479. Now, from the 62 new cases today, we hear that 43 of them are imported cases, raising concerns about the growing number of imported transmissions, which is why the government is planning to require passengers from high-risk countries to submit test results that show they have tested negative for COVID-19 at least 48 hours prior to arriving in this country. The number of deaths remain unchanged at 289, while those in quarantine, the figure stands at 986, and those fully recovered at 12,204. We are still waiting for that briefing to commence, and while we do, perhaps now we can take a look at some of the daily life quarantine measures that the government is asking you to abide by. The measures include the idea of staying at home at least for 3 to 4 days if you find yourself feeling sick, or going to get yourself tested for COVID-19 should you believe you may have been exposed to COVID-19 or the threat of COVID-19. The briefing that is about to start. We'll come back to you afterwards.
부장 설명이 있겠습니다. Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of July 13th, today we have 19 new local infections and 43 new imported cases. The total number of confirmed cases now stands at 13,479. 26 more people have been discharged following full recovery, with about 90.5% of the total making full recovery, while a total of 986 people are in quarantine. We have no additional fatality and the death toll stands at 289. The fatality rate is 2.14%. And here are some major updates on our domestic infections. We have in Gyeonggi-do province, we have a hospital at the Gyeonggi-do hospital, and we have an index case that has been confirmed, and a total of 5 people have been confirmed to date. And in relation to a household in Gyeonggi-do Suwon City, we also have additional cases. A total of 4 people additionally have been confirmed, and 2 of them are the children at a daycare center, and thus we are conducting epidemiological investigation into this daycare center. We have 5 more additional cases related to a door-to-door sales facility in Gwangju City, and one of them was from the Central Church, and 1 from a badminton group, and also 2 people in relation to a T-World, which is a mobile phone store. And as for the imported cases, we have 43 new imported cases. 18 people have been reported at the point of entry, and 25 of the rest have been detected while they were on mandatory self-quarantine. And the countries, 7 of them were from US, 4 from Europe, and 1 from Africa, and 31 from Asia, excluding China, 16 from the Philippines, 9 from Uzbekistan, 3 from Kazakhstan, and they were mostly from Asia. During the past 2 weeks, we have disclosed some risk factors as for infections. And during the past 2 weeks, we looked into the sources of infection, and 42% were the imported cases, and while local infections were 35%. So we had seen a surge in the portion of the imported cases, and we saw a drop in the proportion of infections with unidentified sources of infection of standing at 9%. However, we are seeing increased cluster infections at the Jeolla provinces, and centering around especially door-to-door sales facilities and religious small group meetings. And during the past 2 weeks, we have seen that in the people in the 20s and 30s, it has increased slightly, and the middle to senior aged proportion stands at about 40%. And looking at the trends, global trends for COVID-19, the number of confirmed cases globally, we also have a record rise of the on-day increase, and WHO says that there were over 200,000 cases reported today, and this has also increased significantly starting from May and June, and in July we also have about 230,000 cases on daily average. And as for continents in the US also accounts for a majority of the cases, about 50% in Americas, and Asia is also accounting for a big portion as well. And by country, here are some updates on the analysis, and for every 100,000 people, Qatar, Bahrain, Chile, Kuwait, and Oman are some countries with higher proportion of the infections. And the fatality rates are high, especially in France, Yemen, Belgium, UK, Italy. They had over 10% of the fatality rate. And these global pandemic of the COVID-19 is also continuing to be prolonged, and therefore it's resulting in an increase of the imported cases here in the country. And we had about 169 imported cases, out of which only 48 people were Korean nationals. And all of the foreign entrants entering the country are under a mandatory self-quarantine for 2 weeks, and they need to also be monitored with their health conditions, and all of the imported cases are being confirmed at the points of entry or while they are on self-quarantine. And we also did an analysis of the risk factors of each countries, and we have also a list of high-risk countries, and we are restricting the visa issuance as well as the entry into the country. And as for those countries with higher risks of infection, before they come in to the country, they need to submit a PCR testing negative document, and if they do not have this document, they are prohibited from entering the country. And also, starting from July, we are also decreasing the capacity of the regular passenger flights to about 60%. And as for people who are leaving to these high-risk countries, we are restricting their return as well. And starting from today, all of the foreign entrants, starting from today, they need to submit a PCR negative document that has been tested within 48 hours of entry. And also at ports, we are intensifying our quarantine measures. Starting from today, all of the entrants who are entering from the ports nationwide, all of the foreign entrants need to go under 2 weeks of quarantine at designated residence. And please remember that COVID-19 can spread at any places which is enclosed, crowded, and close contact environments. So refrain from having meetings, outings, and group meetings as well. And please refrain from going to multi-use facilities. And in your daily lives, please practice distancing as well as wearing a face mask. And especially for people aged over the age of 65, please refrain from going to crowded spaces. And if you unavoidably have to visit these places, please refrain from eating together, and also refrain from singing or chanting, and disinfect your hands on a regular basis, and wear your face masks at all times. And as for your health conditions, if you have chronic illnesses, please refrain from going to these places and take regular exercise as well. The WHO has reported that global COVID-19 infections continue to be on a rise, and we also have over 200,000 new daily cases, and it is writing a new record history on a daily basis. Therefore, no one country can expect and forecast the peak of the infection, and many countries nationwide have eased their lockdowns and are opening their borders. And in US, Brazil, and India, between the infections on a daily basis are ranging between 200 to 600,000 on a daily basis. And as for Germany, Hong Kong, and Japan, we are also seeing a resurge of the infections. And the WHO also says that it is very difficult for us to call an end to the pandemic, and it has also warned that countries globally need to prepare for a long-battled war. And globally, we need to exert our full efforts to develop an effective vaccine and therapeutics. However, there are also lingering uncertainties. Therefore, we need to restrict the spread of the COVID-19. However, we need to learn how to live with the COVID-19, how we can live in a safe manner. And therefore, in all areas of life, we need to change our new norms of life in many social areas. And we also, during the past 6 months, we have been experiencing the great changes in our daily lives, which include wearing a face mask and intensified quarantine measures for high-risk facilities, and also a restriction for and practicing of infectious disease prevention measures at high-risk and multi-use facilities, including religious centers as well as schools. However, we are still seeing a continued surge in the number of patients, especially centering around venues like sports gyms, medical hospitals, as well as restaurants and door-to-door facilities and places of worship. And we need to live with the COVID-19 for a prolonged period of time. Therefore, we need to also proactively avoid going to closed, crowded, close contact environment, and we need to ventilate on a regular basis, disinfect on a regular basis, and always wear face masks.
네, 지금부터 기자님 질문에 답변 드리는 시간 갖겠습니다. 현장에 계신 기자님들.
Here on the local front, the latest outbreak is dominated by sporadic cluster infections and imported cases. Against this backdrop, the World Health Organization says the pandemic is not under control and it's getting worse. For more on the status quo, I have Dr. Alice Hyungyong Tan from Miss Mary Women's Hospital. Welcome back, Dr. Tan.
Thank you.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Good to see you again, Dr. Kwak.
Good afternoon.
Right, Dr. Tan, Korea is witnessing a surge in imported cases, as we've talked about earlier on in the program. What do you think is the reason behind this disturbing trend?
Well, I think first of all, the numbers are reflecting what's going on beyond our borders. Obviously, there are many countries that are still struggling to get COVID-19 under control. And we're just seeing how difficult it can be to get control of this virus. Also, the summer months are traditionally when the Korean diaspora return back to Korea to visit family members, and when Korean students who are study abroad students come back home for summer break. And certainly we've seen cases in that category. Korean companies employ hundreds of thousands of migrant workers from developing countries such as Uzbekistan and Bangladesh, Pakistan, and there are cases in that category as well. I think the numbers, though, are also showing us just how effectively we are diagnosing and detecting cases. It would be actually worse if the numbers were zero and there were actual cases that were coming in. Now, our maritime ports were blind spots for us, but we have since fortified that line of defense. And so hopefully we will see no imported cases that are going undetected through those maritime ports, and we'll be able to fortify and have a comprehensive defensive strategy.
Right. Dr. Kwak, following cluster infections centered in the metropolitan region, we've seen domestic transmissions spreading to other parts of the country, namely the city of Gwangju. Do you believe we'll continue to see an uptick in domestic transmissions?
I would think so. This was, as I always say, this was to be expected when we actually took down a notch from the social distancing measures to daily life distancing measures. It means that we're going to keep seeing some untraceable confirmed cases pop up here and there. Hopefully that will not spread out to create another cluster infections. But at this point of time, I think it's the job of us actually to watch over those who are infected and make sure that they do not become severe in the progress of the illness, but rather seeing those minuscule numbers coming up, let's say within the 20s or even 10s, I think it'll be okay to keep monitoring on them as long as the numbers stay quite low.
Right. Now, meanwhile, the United States is by far the worst hit country in the world with more than 3 million cases of COVID-19. Accordingly, before we delve further into the situation here in Korea, we connect to Professor Robert Siegel at Stanford University for more on the situation in the U.S. Hello, Professor Siegel.
Hello, Sunny. It's a great pleasure to talk with you.
Yes, Professor. Now, this past weekend, the U.S. saw its daily high hit almost 70,000, Professor. Please tell us more about the situation there in the U.S.
In terms of the number of cases, things are basically getting worse, and it seems like it's out of control. Tell me more.
Professor, what do you believe is the reason behind the rampant spread of the virus then in the U.S.?
Well, the spread of the virus in the U.S. is primarily due to the fact that people here, are balancing the cost of the measures to control the virus with their ability to have their autonomy. And for many of the people here, they are measuring the balance in terms of the economics and their autonomy, and they're willing to even put their lives at risk in order to use that.
I see. That's quite unfortunate to hear. Now, Dr. Kwak and Dr. Dan, if there are any questions you'd like to ask Professor Siegel, please go ahead. We could start with you, Dr. Kwak.
Thank you. Thank you, Dr. Siegel, for sparing your time to share your expertise with us. I would like to ask you, because in Korea, we're going into about second week of using remdesivir on more severely ill patients from COVID-19. And we've thus far had about 42 cases where we injected the remdesivir, and we've had about 9 improvements, but unfortunately 3 getting more severe with the illness. I just wanted to take your insight on the U.S.'s assessment on the use of remdesivir on severely ill patients.
So I think remdesivir is a very promising antiviral drug. Unfortunately, it's hard to give. It has to be given to hospitalized. It's given to hospitalized patients by intravenous infusion, and it's also in short supply, which is why it's given to the most seriously ill individuals. So ideally, remdesivir would be given much earlier in infection, and it would be great if there were an orally available version. So researchers are currently testing an aerosolized version, which would definitely be an improvement. However, it should be noted that the aerosolized procedures could also put healthcare workers at risk.
Dr. Tan, I believe you also have an inquiry for Professor Siegel.
Right. So Korea has seen close to 2,000 imported cases so far, and there have been days such as today where the number of imported cases actually outnumber cases from the community. I recently sent my parents home from Korea to San Francisco International Airport, and I had a really hard time trying to find guidance for what sort of quarantine they had to do upon arrival. And I was wondering if you had insight as to what the policy is for the United States for imported cases. How are you trying to control imported cases, and also the influx of cases from high-risk hotspots within the United States to low-risk communities, so going from LA or Houston to low-risk communities in rural America. Is there a policy? And also, is the U.S. even tracking in real time the impact of imported cases on the total caseload?
Thank you, Dr. Tan. Excellent question. We have no national policy, so there's various policies state by state, so it's a little bit difficult to keep track, and in some cases there's even differences in county by county policies. So many states actually have a self-quarantine, but it's not nearly as rigorous as it is in some other countries. Because the number of local transmission is so high, it's actually difficult to actually distinguish the number of cases that are actually due to imported cases. So until we bring the numbers down, it will be difficult to sort of tease out. The best data we actually have is genomic data, where we can see that certain cases are coming from different regions of the world. But the vast majority of cases here are local cases in nursing homes, in factories, in prisons. So those are the major outbreaks here.
I see. All right, Professor Siegel, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you very much.
Dr. Kwak, on a slightly different yet related note, there is talk about an alarming rise in cases of pneumonia cases in Kazakhstan. What can you tell us about this health concern there?
So I checked on it, and Kazakhstan apparently had denied allegations that there has been a fast rise in the numbers of pneumonia deaths. But it seems like we're going to see a lot of these happening all over the world, from countries where they cannot mitigate as well as the other countries, like for instance that of Brazil or in Kazakhstan. For those cases, I think it might be a sign that we might be seeing some sort of second wave coming in soon. I believe if we look back to history in 1918 of the Spanish flu, it was a global effect. It was a global wave that was waving throughout the world. That the cases were actually being imported from other countries. For our case, though, we had managed very well, and we mitigated the spread of the virus so well that we are continuing seeing very low. But we also need to pay extra attention to possible cases coming in from foreign countries like Kazakhstan for now, I think.
Right. And what is alarming is, Dr. Dan, in reality, Korea's imported cases include those from Kazakhstan. What measures do health authorities have here to deal with this predicament?
Well, we are taking a risk-adaptive approach currently. So in terms of issuing travel restrictions, we are assessing which countries are at highest risk for bringing positive cases into Korea. Now, we have had since June 1st a policy that required negative PCR documentation or a medical certificate, and this actually applied to the United States since June 1st, with the exception being for holders of A1, A2, A3, and F4 visas. Now, this has been expanded now, and we heard today 4 more countries are now being required, the passengers are being required to present a negative COVID-19 PCR test result before they can board the plane. I think this was a smart move because even today we've had so many imported cases, and it is presenting a burden to our healthcare system. In terms of other measures, I think we have a mandated in-flight procedures now for physical distancing and the wearing of masks throughout the flight. But this issue highlights how important global solidarity is for tackling this pandemic. COVID-19 is not going to go away in Korea unless it goes away all over the world. And so we can't just think in isolated terms. We have to think of the big picture.
Right, it has to be a global effort. Dr. Kwak, what are your prospects on Korea's plasma-driven COVID-19 treatment?
I have very high expectations. From past multiples of studies, they've shown at least about 60 to 70% of improvement rates. And we've also had that about 2-3 months back at that Severance Hospital where they cured, well, not cured, but where they treated 3 patients with convalescent therapy and 2 were cured of them. This, with the mixture of remdesivir and some possible other medications coming into place, I am staying very hopeful for the treatment regimens that we're about to see.
Right. Dr. Tan, according to results of a preliminary analysis, 90% of Korea's COVID-19 cases were mild infections. What meaning does this finding have, do you think?
Well, we knew from the very beginning, from reports from China, that about 80% of cases were going to have mild to moderate clinical course. And so our Korean findings confirm this finding. Now, what this means is we're catching a lot of asymptomatic cases. We're catching our cases early on. And also, these mild cases, when they go into isolation, these patients can be productive. We don't need to isolate them completely from their jobs and their work, and they can be productive members of society even though they are in isolation. So I think we need to rethink our strategy in terms of how we are using our resources, our financial resources, our medical resources. Now, 7 of the 3,200 patients that were in monitored isolation facilities ended up requiring higher acuity care. That means the vast majority of the other patients perhaps didn't need intensive monitoring or medical oversight. So I think we need to zone in on who is at risk for developing more severe symptoms, and perhaps the other cases we could have in a sort of a dialed down version of monitored isolation. So this information, I think it's good news, but it also gives us information in terms of how we need to go forward. How do we need to be smart about managing our resources?
Right. Dr. Kwak, I take your attention back to the city of Gwangju, where the population, of course, compared to Seoul, is very, very small, about a little over 1 million people there. Authorities are worried that cases there might spiral out of control. What are your views on that? Because the Daegu situation in Daegu and its surrounding North Gyeongsang province ended up becoming an epicenter. Do you see this taking place in Gwangju?
Well, it's a possibility, certainly, but I'm not going to say that there is greater risk with Gwangju, because we've already seen what happened in Daegu. People are aware of what we need to do. It's not the matter of governmental measurements that needs to be taken extra, but more so it's the reinforcement among people how we should keep caring for ourselves. Meaning we should again keep the basics, as in keeping the hygienics or sanitizing measures. Always wear the mask when you're going out to places, and also staying away from gathering of a lot of people. So the basic core of the issue is really just keeping the guidelines that were already given to us.
The personal hygiene guidelines and, of course, safety precautions. Wear your mask, keep away from crowds, etc.
Exactly.
I see. All right, Dr. Kwak, thank you for your thoughts. And Dr. Dan, as always, thank you for being with us today.
Thank you.
Right, well, that brings us to the end of Monday's edition. Be sure to join us tomorrow as we discuss in depth Korea's version of the New Deal following a public address on the initiative by President Moon Jae-in also tomorrow. In the meantime, do reach out to us through our social media accounts or homepage, arirang.com. See you tomorrow.